If you're over 60 and your doctor recently congratulated you on getting your blood pressure down to that perfect 120/80, I need you to stop and listen carefully, because what I'm about to share might change how you think about your health forever. A major study followed thousands of older adults for years, and what researchers discovered directly contradicts almost everything we've been told about blood pressure targets for people your age. The seniors who achieved that so-called ideal number didn't do better. In many cases, they did worse. They had more falls, more hospitalizations, and in some groups, their mortality rates were actually higher than those with moderately elevated numbers. In the next few minutes, I'm going to reveal the exact blood pressure range associated with the longest survival in older adults. Why chasing the standard target can become genuinely dangerous after age 65. And one simple test you can do at home tonight that could prevent a devastating fall. I'm Dr. Leon Hayes, and this information could genuinely protect your life or the life of someone you love deeply. Before we go any further, I want you to do something for me right now. Drop a comment with just your age. Nothing else, just your age. I want to see exactly who's watching this, because the information I'm about to share applies very differently depending on whether you're 62, 72, or 82. Your body, your arteries, and your medication tolerance are all different at each of those stages. And here's something even more important. If you have ever felt dizzy, lightheaded, or unsteady when standing up from a chair or getting out of bed in the morning, add the word dizzy to your comment. This is not a small detail. This is critical information, and you'll understand exactly why in just a few minutes. That simple symptom might be telling you something your doctor has never checked for. Let me paint you a picture of what's happening in doctors' offices all across the country right now. Probably today. Probably this very hour. A 74-year-old walks in for a routine checkup, feeling fine, no complaints. The nurse takes their blood pressure and it reads 146/86. The doctor pulls up the standard guidelines on the computer screen, sees that target of less than 130 systolic staring back, and immediately reaches for the prescription pad. One medication gets added. A few months later, maybe a second one. And over time, that blood pressure comes down beautifully. Right down to 122/76. The doctor is thrilled. The patient gets a gold star on their chart. Everyone walks away thinking this is a clear success story, a job well done. But here's what those guidelines on the screen completely fail to account for. That same 74-year-old now gets up in the middle of the night to use the bathroom. And the moment they stand, their blood pressure plunges from 122/76 down to something like 88/54 within seconds. Their brain suddenly isn't getting enough blood flow. The room spins. They reach out for the wall, but their hand misses. And in that instant, we are no longer talking about numbers on a chart. We are talking about a fractured hip, an ambulance ride, emergency surgery, weeks in rehabilitation, and a cascade of complications that far too often ends in the permanent loss of independence, or something even worse. This is the story nobody warns you about. The research on this should have made headlines everywhere. It should have been front-page news. But most doctors still haven't seen it, and most patients have never even heard a whisper of it. And that enormous gap between what the research actually shows and what happens in everyday medical practice is quietly costing lives every single day. So stay with me here, because this is where everything you thought you knew starts to change. For decades, the message has been beautifully simple. Lower blood pressure equals better health. And for middle-aged adults, people in their 40s and 50s, that message is largely true. Getting your blood pressure under control during midlife genuinely prevents heart attacks, strokes, and kidney disease down the road. The evidence there is rock solid, and I would never tell a 50-year-old to ignore high blood pressure. But something fundamental shifts as we age. The research increasingly shows that older adults with systolic blood pressure in a moderate range often live longer than those pushed below 120. They experience fewer falls, fewer fractures, fewer hospitalizations, and in many cases, better cognitive function. The group that achieved that textbook perfect number frequently had higher rates of dizziness, fainting, kidney strain, and yes, in some studies, higher overall mortality. It sounds backwards, I know. But once you understand why, it will make complete sense. If you're the kind of person who wants to understand the why behind the numbers, not just be told what to do and sent on your way, then what I'm about to explain will give you an entirely new framework for thinking about your blood pressure as you age. Because your cardiovascular system at 75 is not simply an older version of your cardiovascular system at 45. It is fundamentally different in ways that completely change what those blood pressure numbers actually mean for your health and your safety. Let me walk you through the 3 critical changes that happen as we age and why they demand different targets. First, arterial stiffness. As the years pass, your arteries gradually lose their elasticity. Think of a brand new garden hose compared to one that's been baking in the sun for 20 years. The old one is stiff, brittle, less flexible. Your arteries go through a very similar process. When your heart pumps blood into stiffened arteries, they simply cannot expand and absorb that pressure wave the way young, flexible arteries do. This means your body often needs a slightly higher baseline pressure just to push enough blood up to your brain and out to your kidneys, especially when you're standing upright and that blood has to travel against gravity. Second, your baroreceptors weaken. These are tiny pressure sensors sitting inside your blood vessels that constantly detect changes and instantly signal your brain to make adjustments. When a young person stands up, these sensors catch the pressure drop within milliseconds and trigger a rapid response. The heart speeds up, vessels tighten, and pressure stabilizes before you even notice. But with age, these sensors become sluggish and slow. So if your baseline pressure is already being held artificially low by medication, and your sensors are responding too slowly, you get that sudden, dangerous drop when you stand. Doctors call this orthostatic hypotension, and it is one of the biggest hidden causes of falls in older adults. Third, your body processes medication differently. Your kidneys and liver simply don't clear medications as efficiently at 75 as they did at 45. A dose that's perfectly appropriate for a middle-aged person can be far too strong for an older adult. The medication lingers longer in your system, hits harder, and can drive your pressure down further than anyone intended. Combine all 3 of these changes together, and you can see why treating an 80-year-old exactly like a 50-year-old is a recipe for trouble. Now let me tell you what the research actually found, because the specifics really matter here. Studies have followed thousands of adults over the age of 75 for years at a time, and these were not carefully selected, perfectly healthy seniors. These were real-world older adults, the kind you see every day, including people with diabetes, prior strokes, existing heart disease, and varying levels of frailty. Researchers tracked their average blood pressure and then watched carefully to see what happened to them over those years. They divided everyone into groups. One group kept their pressure below 120. Another sat between 120 and 130. Another between 130 and 140. Another between 140 and 150, and another above 150. Here's what emerged from the data. The lowest mortality rate was not in the group below 120. It was not the textbook perfect number at all. It was the moderate range, right around 130 to 140. Those pushed below 120 showed a significantly increased risk of serious falls requiring hospitalization. They had higher rates of kidney strain, because their kidneys simply couldn't get enough blood flow to function well at that lower pressure. And their overall mortality was measurably higher than those in the moderate range. Now, the group above 150 also had real problems, exactly as you'd expect, with more strokes and more cardiovascular events. But the genuine surprise, the finding that shocked researchers, was that very low pressure turned out to be nearly as dangerous as very high pressure. The sweet spot, the range tied to the longest survival and the best quality of life, sat higher than the conventional guidelines have been telling us for years. Let me make this real. Imagine you're 76 years old. You walk into your doctor's office feeling perfectly fine. Your blood pressure reads 142/84. Your doctor looks concerned, pulls up the guidelines, and says we need to get this down closer to 120. You start a medication. 2 months later, you're at 128/78. Your doctor is pleased but suggests adding a second pill to nudge it lower still. Another 2 months pass, and now you're at 122/76. Perfect, your doctor says. And at first you feel fine, but then you start noticing things. When you rise from your chair to answer the phone, you feel momentarily lightheaded. When you stand up from the dinner table, the room seems to tilt for just a split second. You mention it, and you're told it's probably just age. Just stand up slowly. Take your time. But what's actually happening is that your pressure, which looks flawless while you're sitting still in that office, is crashing when you stand, dropping from 122/76 down to maybe 95/60. Your brain is experiencing repeated episodes of inadequate blood flow, and you are at genuine risk for a fall. Yet nobody is checking, because your sitting number looks textbook perfect. This exact scenario plays out thousands of times a day across this country, and the tragedy is that it's largely preventable. It's preventable once we accept that blood pressure targets must be individualized, based on your age and your functional status, not stamped uniformly onto everyone. Now here's what genuinely frustrates me. There's a simple test taking barely 3 minutes that can reveal whether your blood pressure medications are quietly setting you up for a dangerous fall. It's called orthostatic vital sign measurement, and most doctors simply aren't doing it routinely. So let me teach you how to do it yourself at home tonight, because this could truly be life-saving. All you need is a home blood pressure monitor, available at any pharmacy for around $30. Here's the exact protocol. Lie down flat on your bed or couch and rest quietly for 5 full minutes. After those 5 minutes, check your blood pressure while still lying down and write down both numbers. Then stand up and immediately check it again while standing. Don't wait, don't pause, do it right away. Write those numbers down too. Now compare them. If you're systolic, the top number, dropped by more than 20 points, or you're diastolic, the bottom number, dropped by more than 10 points, you have orthostatic hypotension. That is a red flag waving right in front of you. It means your medications may be too strong, or your target may simply be too low for your physiology. Even if your resting numbers look flawless by traditional standards, that drop when you stand puts you at real risk. Let me give you a concrete example. Say your lying pressure is 125/78. Beautiful on paper. But when you stand, it falls to 98/64. That's a 27-point drop. That's dangerous. Your brain is running short on blood flow whenever you're upright, which is most of your waking hours. You might feel fine lying down, but standing, you're operating on empty. This is the test your doctor should perform at every single visit if you're over 65 and on blood pressure medication. If they're not doing it, do it yourself and bring those results to your next appointment. So what should your blood pressure actually be? Let me give you the ranges research suggests are tied to the best outcomes. But understand these are guidelines, not rigid rules, and your personal target must be worked out with your doctor. For generally healthy, active adults aged 65 to 74 with no major conditions, a systolic range around 130 to 140 is reasonable. It offers cardiovascular protection while keeping enough blood flowing to your organs. For relatively healthy adults aged 75 to 84, the evidence supports a slightly higher range of about 135 to 145, accounting for stiffer arteries and slower sensors. For those over 85, or anyone who is frail regardless of age, a range of roughly 140 to 150 may be most appropriate, because at that stage, preventing falls and preserving quality of life often matters more than aggressive lowering. And what about that bottom number, the diastolic? For older adults, it should generally stay above 65, ideally sitting somewhere between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle itself during its resting phase and can cause real problems. If yours consistently drops below 60, that's worth discussing, even if your top number looks fine. Now consider someone who's 73 with type 2 diabetes and a heart attack 5 years ago, sitting at 148/86. Should they aim for 120? Probably not. Should they ignore it entirely and sit at 150/90? Also no. For this person, a target around 130 to 135 might be optimal. Low enough to protect them given the diabetes and heart history, but not so low it invites falls. The key is reaching it gradually, with careful monitoring every time a medication changes. Orthostatic readings should be checked, and symptoms like dizziness, fatigue, and foggy thinking must be taken seriously, because those may signal that pressure is being pushed too low even when the numbers look good. And here's something most people never realize. Blood pressure swings throughout the day. A single reading of 148/86 does not mean it's always that high. It might be 132 in the morning and 145 in the evening. What truly matters is the average over time, which is exactly why home monitoring is so valuable. It paints a far more accurate picture than a few random office readings ever could. You might be wondering, if this research exists, why hasn't my own doctor mentioned any of it? The answer is complicated but honest. Medical guidelines are built on large trials that take many years, and the landmark studies establishing 120/80 were done mostly in middle-aged people. Those results got applied broadly across every age group, on the assumption that what helps a 50-year-old must help an 80-year-old too. Only over the last decade have researchers focused specifically on older populations and discovered that one size truly doesn't fit all. The problem is that it takes years for new research to reach guidelines, and even longer to change everyday practice. Many doctors are still working from guidelines written years ago. There's also a deep psychological factor. For an entire generation, doctors were trained that lower always means better, and that mindset is remarkably hard to shift. Add in a healthcare system that allows barely 15 minutes per patient, and truly individualized care becomes genuinely difficult. Let me show you how different two people of the same age can be. Both are 81. The first lives independently but manages several chronic conditions: mild heart failure, moderate kidney disease, and arthritis, with a reading of 158/88. The second is also 81, but healthy, active, plays golf twice a week, no major problems, and their reading is also 158/88. Same number, same age, completely different situations. For the first person, piling on multiple medications carries serious risk. It could drop their pressure too far when standing, worsen their kidneys, and trigger dizziness that, combined with arthritis, could be catastrophic. A wiser approach might be lifestyle changes first, then perhaps a low dose of one medication with careful monitoring, accepting a target closer to 140 to 145. For the healthy golfer, gentle treatment or even lifestyle changes alone might bring them to a perfectly acceptable place without aggressive medication at all. Same numbers, different people, different plans. This is what we mean by treating the patient, not just the number on the screen. So let me leave you with concrete steps you can begin tonight. First, if you're over 65 and on blood pressure medication, get a home monitor and check your pressure at the same times each day for 2 weeks, morning and evening, keeping a written log. Second, perform that orthostatic test I described, lying down 5 minutes, then standing, and write down any significant drop. Third, honestly assess your symptoms. Dizziness, unexplained fatigue, trouble concentrating. These may be signs your pressure is too low. Fourth, schedule a visit specifically to discuss your target. Don't accept a blanket 120/80. Ask what's right for your age, your conditions, and your functional status, and bring your logs. Fifth, if medications are causing side effects, speak up. Don't suffer in silence assuming dizziness is just something you must endure. Doses can be adjusted, medications changed, targets modified. Here's what you now understand that most people, and even many providers, don't fully grasp. Blood pressure targets should never be universal. A 45-year-old and an 85-year-old cannot be held to the same standard. For older adults, especially over 75, a moderate systolic range is often tied to the longest survival and the best quality of life. Too low invites falls, kidney strain, and cognitive decline. Too high invites cardiovascular risk. The sweet spot lives in the middle. You've learned that the drop in pressure when you stand is often more dangerous than moderately elevated sitting pressure, and you now know how to test for it at home. You understand the physiological reasons behind it all: the stiff arteries, the sluggish sensors, the altered medication processing. And most importantly, you now have the knowledge and the language to have a real, informed conversation with your doctor. You are no longer a passive recipient of advice. You are an active, informed participant in your own care, and that is genuinely empowering. You are now more informed about blood pressure in older adults than probably 90% of people your age. If this gave you clarity, if it answered questions you've quietly carried, if it gave you the confidence to advocate for yourself, then I've done my job well. Drop a comment saying "informed" if you feel more equipped now. Share this with friends or family over 60 who might truly benefit. And subscribe, because my mission is bringing you research-based health information that's practical, honest, and potentially life-changing. In my next video, I'll reveal the 3 supplements research suggests can genuinely support healthy blood pressure naturally, and the 2 popular ones that are complete wastes of your money. You won't want to miss it. I'm Dr. Leon Hayes, and I'll see you there. This video is for educational and informational purposes only, and is not intended as medical advice. Blood pressure management should always be individualized based on your complete medical history, current health status, and other personal factors. Never adjust or discontinue any medication without first consulting your own healthcare provider. The information here reflects current research, but should never replace professional medical care. Always speak with a qualified healthcare provider before making any changes to your treatment plan, because your safety and your health always come first.